Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. The nurse must verify the client's identity before administration of medication. Which of the following is the safest way to identify the client? Option A. Ask the client his name. Option B. Check the client's identification band. Option C. State the client's name aloud and have the client repeat it. Option D. Check the room number. Right answer is Option B. Check the client's identification band. The identification band is the safest way to know the identity of a patient, whether he is conscious or unconscious. Ask the client his name only after you have checked his ID band. The nurse prepares to administer buccal medication. The medicine should be placed. Option A. On the client's skin. Option B. Between the client's cheeks and gums. Option C. Under the client's tongue. Option D. On the client's conjunctiva. Right answer is Option B. Between the client's cheeks and gums. Buccal administration involves placing a drug between the gums and cheek, where it also dissolves and is absorbed into the blood. The nurse administers cleansing enema. The common position for this procedure is Option A. CIMS left lateral. Option B. Dorsal recumbent. Option C. Supine. Option D. Prone. Right answer is Option A. CIMS left lateral. This position provides comfort to the patient and an easy access to the natural curvature of the rectum. A client complains difficulty of swallowing when the nurse tries to administer capsule medication. Which of the following measures should the nurse do? Option A. Dissolve the capsule in a glass of water. Option B. Break the capsule and give the content with an apple sauce. Option C. Check the availability of a liquid preparation. Option D. Crush the capsule and place it under the tongue. Right answer is Option C. Check the availability of a liquid preparation. The nurse should check first if the medication is available in liquid form before doing dissolve the capsule in a glass of water. Placing it under the tongue is not the intended way of administering an oral medication. Which of the following is the appropriate route of administration for insulin? Option A. Intramuscular. Option B. Intradermal. Option C. Subcutaneous. Option D. Intravenous. Right answer is Option C. Subcutaneous. The subcutaneous tissue of the abdomen is preferred because absorption of the insulin is more consistent from this location than subcutaneous tissues in other locations. The nurse is ordered to administer ampicilin capsulated PO. The nurse should give the medication. Option A. 3 times a day orally. Option B. 3 times a day after meals. Option C. 2 times a day by mouth. Option D. 2 times a day before meals. Right answer is Option A. 3 times a day orally. TID is the Latin for ter indi, which means 3 times a day. PO means per orum or through mouth. Back care is best described as Option A. Caring for the back by means of massage. Option B. Washing of the back. Option C. Application of cold compress at the back. Option D. Application of hot compress at the back. Right answer is Option A. Caring for the back by means of massage. Back care or massage is usually given in conjunction with the activities of bathing the client. It can also be done on other occasions when a client seems to have a risk of developing skin irritation due to bed rest. The goal when performing this procedure is to enhance relaxation, reduce muscle tension and stimulate circulation. It refers to the preparation of the bed with a new set of linens. Option A. Bed bath. Option B. Bed making. Option C. Bed shampoo. Option D. Bed lining. Right answer is option B. Bed making. Bed making is one of the important nursing techniques to prepare various types of bed for patients or clients to guarantee comfort and beneficial position for a specific condition. The bed is particularly important for patients who are sick. The nurse plays an inevitable role to ensure comfort and cleanliness for ill patient. It should be adaptable to various positions as per patient's need because they spend varying amount of the day in bed. Which of the following is the most important purpose of hand washing? Option A. To promote hand circulation. Option B. To prevent the transfer of microorganism. Option C. To avoid touching the client with a dirty hand. Option D. To provide comfort. Right answer is option B. To prevent the transfer of microorganism. Hand washing is the single most effective infection control measure. What should be done in order to prevent contaminating of the environment in bed making? Option A. Avoid fanning soiled linens. Option B. Strip all linens at the same time. Option C. Finished both sides at the time. Option D. Embrace soiled linen. Right answer is option A. Avoid fanning soiled linens. Fanning soiled linens would scatter the lodged microorganisms and dead skin cells on the linens. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.